Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
And today, Brad, we're going to talk about how to stop low back pain at home using a shotgun approach.
The shotgun approach.
So we're going to take an actual shotgun and shoot your back, and it's going to feel a lot better?
I'm afraid not, Bob. But you know, when I first started in therapy 20 years ago, I had a therapist who was my mentor, and this is what he termed it. He says, you know, sometimes you just got to throw everything at it and get to the point right away, even if you're not sure which specific exercise is going to do it or which treatment, but you know it's not going to hurt, so just get after it.
I do this a lot too, Brad. I have a patient, we try some things and we see what works.
Right.
There's, you know, the ones that generally do work, but they don't always, and
right.
sometimes you have to throw some, you know, different options at them.
Sure.
So, all right, in case you are new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Also go over to the Facebook and like us, because Brad and I, it's a sad story. We're not liked as children, and now we're trying to turn things around. So
yeah, click the like button or whatever you do.
Yeah, I don't know how to do that, but all right. So Brad, let's start off with number one. How do you want to start?
Well, let's say the back. You know, this is back pain. It's come on and it's severe, and you got to continue on with your life, obviously, and you really want to, you know, get things going as soon as possible. So there's probably two scenarios that we were going to touch on both. If you've got central back pain or back pain here, or if you have back pain with...
So it's localized.
Right, okay. There. Or, you know, if you have back pain with the pain...
Going down the leg.
Down the leg, you know, the sciatica symptoms. And we're going to address both of those.
Okay, so two different scenarios. Just back pain here or back pain
right.
also going on the leg. Okay.
But the treatments are pretty similar. They're going to cross over quite a bit. The first thing you need to do is, if it's severe and you got one of those situations where you're walking like this and it just hurts to sit, it hurts to move it, you get that thing, everything hurts. You need to find a comfortable position and then use a cold pack on it. And so that's what we're going to go over first.
Okay.
And actually at the same time you're going to do that, as long as you tolerate ibuprofen or some kind of anti-inflammatory across-the-counter medication, you want to start that as well.
And the ibuprofen they recommend, I mean, we talked to a pharmacist about this,
right.
and he said kind of do a 3-day blast.
Right. Actually, yeah, pharmacist, and I talked to my doctor, my regular MD.
Oh, you did?
Yeah, and this was his prescription, which I talked to the pharmacist, and they both agreed.
I see.
Yeah, so it's got a lot of feedback on this.
So they're saying, if I remember right, 3 times a day.
Right.
Times 3 days,
right?
And it's like 600 milligrams, didn't they?
Depends on your body weight.
Oh, sure.
Right. So if you're not sure, you know, look it up. But typically, like I'm 180 pounds, I can take 3 up to 4 200 milligram ibuprofen.
Wow, up to 800.
Right.
Oh wow.
Right. That's a max for you. But if you're a lighter person, you're going to take less. If you're 100
pounder,
if you're 100 pounds, it's probably 2, possibly 3. You need to check on that.
So I can maybe take 5.
Oh, Bob, yes. But anyway, so you're going to take the prescribed 3 times per day. You're going to get on that right away. You're going to find a comfortable position, which oftentimes we find laying down.
Yeah, the leg wedge works with a lot of people.
Right, but you could just use pillows as well, put pillows under your back. I've had people lay on a carpeted floor and put their feet up on soft furniture.
Oh,
to get
sure.
in that 90-90 position.
Or even lay on put their foot up on the couch. I mean, you can lay on the floor and put your foot up on the couch.
Right,
Yeah.
Yep, perfect. Cold pack is one of your best friends when you're really inflamed. You don't want to put a hot pack on it.
To start.
To start, yeah. Right. Initially, we're putting that cold pack.
So if it's just starting up, it's just acute, what we call acute, meaning it just happened, you want to start with that cold pack. But eventually, you definitely could try the hot
sure.
heating pad. Or
typically after 2 or 3 days,
right.
depending on how it's feeling. You know, if it's still really tender and sore to the touch, you may want to stay with the cold pack.
I just got one of these for my wife, but not for her back. I got it for her knee.
Oh, really? Yeah.
Because it was a good position for her knee to be in.
Sure.
And she thinks I'm a genius. I said, it wasn't me, but her knee pain has gone away. Now, she did some other things, too, which we're going to go over in another video today.
Okay. But we're talking about backs.
Oh, yeah, that's
today.
right. Let's go back.
Let's get back on track. Okay, so you're going to lay down with a cold pack 20 minutes. You can go longer. I actually use this when I have a flare-up, and I'll fall asleep with it in bed, and then I'll wake up and I'll just put it on the floor.
Push it off to the side.
Because it's settled down by then.
Sure.
So those are 2 things to start out right away with. The ibuprofen, comfortable position, cold pack. You can use a cold pack in this position 3-4 times a day.
Now, the idea with the ibuprofen is to do it 3 days and then stop.
Right.
I mean, not keep going with the ibuprofen.
Right. It's done what it's going to do,
Right.
and plus it's going to save your stomach and your liver and those things.
Right. So
It's being safe with it. Okay. Next thing, once you can start to walk without irritating it or walk as far as comfortable, I want you to start walking.
yeah,
Okay.
walking is a big part of trying to get your back to recover.
And I just read a book on it, and they said exactly the same thing. And I'm going to say walk on the flat. If you're going to walk outside, don't walk up hills or on uneven
Right.
ground, on a nice flat surface. And, you know, like if you live in town, you can walk around the block so that if you get too far out when you've had enough, you can easily get to your...
If you're on a treadmill, by the way, a lot of them kind of have a natural incline. Sometimes you just want to go to the back of the treadmill and put the screws up so that you raise it up a little
Sure.
bit. I just had a neighbor that was having trouble with sciatica, and she was having trouble on the treadmill, and we just raised up the back, and it felt better then.
Perfect.
So,
Good input.
yeah.
Okay, so again, cold pack, position ibuprofen, start walking. If you find yourself having one of these shifts, we call it a lateral shift where you're crooked and you can feel it, or someone else, you know, you can see it when someone walks in the clinic.
They walk in right away.
It's like, as a therapist, it's like, you know, one of the first things you're going to work on.
Yeah, you got to correct that shift. If you don't correct that shift, your back pain's not going to get better.
Right.
So you got to get back to normal again.
Right.
And Brad's going to show an exercise to do that, right?
So if you shift, like you can see I'm shifted to my left, I'm going to take my left shoulder. Can you get over here, Lonnie? My feet are going to be about a foot from the wall right here and close together. I'm going to take this elbow and bring it up here and elevate the shoulders slightly.
I always put a towel here too.
Oh,
Brad.
that's a good idea.
Right
Yep.
here, like that.
There you go. And then you're going to, this gap right here, can you show him that, Bob?
Yep, he's got a gap right here, and he's going to be pushing his hips this way.
Right.
And this is going to straighten him out.
Now, you're going to do this gently. You know, you're not going to just force it in right away. You're going to kind of bump into it, and it might take 10 or 15 times. And particularly if you're having leg pain with this, if you do this and the leg pain starts getting better, that's golden. If you do this and it starts getting worse, it might be too early for it, but you got to give it a few repetitions and give it a chance.
Well, and it's one you're going to do throughout the day, Brad.
Sure.
I mean, you can do this every hour.
Yeah.
So, but you got to get it straight before your back won't get better.
Sure.
I mean, it can go on and on.
Right, right.
So
typically about 10 repetitions is all you need to do at once. You don't want to keep doing it 30, 40 times. That's too much.
And then the next one's laying down, Brad.
Yep. And this one can kind of cross over.
Sure. This one almost everybody can do.
Right away, depending on how it's feeling. When you can start laying in bed with your knees up, we call this hook line position, knees together, feet together, and we just start going gently back and forth. I call these windshield wipers to my patients. Yeah, because the knees are going back and forth. And sometimes what will happen, and Bob and I talk about this a lot, is maybe to the right, it feels pretty good, but to the left, you bump into it, and it hurts. Don't push into that pain. You're just going to go up to it, and then you're going to go to the right. You might go to the right 5 or 10 times in a row, and then go back to the painful way, and oftentimes you'll feel you can go a little bit farther.
Subsided.
So all these things, we're working pain-free range of motion or close to it.
Yeah,
we're
you
not,
can start with really small arcs if you want to.
Exactly. So again, we're trying to get motion back into this without irritating the back.
I'll do the next one, Brad.
Sure.
So now if you're starting to get pain down the leg, all the way down the leg, then you're going to want to make sure you try the McKenzie method, basically. And you're going to want to try some extensions. Now we're just going to show the basic pattern today.
Well, let's even back up, because if we are in that initial flare-up, we may need pillows.
Oh, sure. Gotcha.
You may not be able to tolerate laying flat. You're going to do this not on a table like this, but on a carpeted floor is the best.
And
if you can get down
you
on
might
the
need
floor.
more than one pillow, even, but we'll start off with just one here,
Right.
Brad. But you're just going to start by laying down and see how your back feels with that. If it feels fine, or if it doesn't feel fine, maybe try a couple more pillows.
Right. The idea is it builds up the waistline, and then the back is more comfortable there. But
Right. It's like this. And then gradually you're going to take the pillows away.
Right.
And get into this position. And then gradually you're going to get into this position.
Sure.
The prone prop here. Now, and the final move then is to try to go ahead and do some press ups. So you put your hands underneath your shoulders and you're going to start pressing up like this.
Right.
Now I'm not lifting up my pelvis. I'm keeping that down on the bed, and I'm trying to put an arch in the back.
Right. So right here stays glued down right at the belt line. Now, it may take a few days before you can start to do press-ups, but we're still working towards that direction with the pillows and then without the pillow on elbows.
Now, we should say, too, Brad, you can do these with regular back pain, too, just
Sure.
pain in the back.
Yep.
I mean, by all means, you
Right.
can try these. These are good for most back situations except for what Brad has.
Spondylolisthesis and stenosis.
Spinal stenosis would not be good for those. So eventually you want to get way up into here.
Sure.
And we've got other variations on that too. We don't want to go into that now.
Well, we don't have time. That's
Yeah.
more once it starts to feel better typically. Okay.
And then, go ahead, number 7,
Right.
Brad.
And I would say, Bob, would you probably agree with this? Anytime someone comes in with back pain, we're addressing posture.
Yeah, immediately.
Particularly seated posture. Oftentimes, if sitting is uncomfortable, you want to minimize your sit time as much as possible. We understand if you got to drive to work, you got to sit in your car. So at that point, we look at lumbar support. Actually, the support where the pain is, you know, starts here, and if it's going down the leg, we want some lumbar support. And we actually have a sample of lumbar supports. If you look here, we got 1, 2, 3, 4, those two are the same, 5, 6 different lumbar supports, and there are many more.
Yeah.
And you can see the differences, the size of them. And that depends on the person's body shape, the type of chair you're sitting in, whether it's soft, firm, car seat, or if it's in a
Office chair,
recliner.
Yeah.
But we do want, let's just grab one of those out, Bob, that you like. There.
I'm not sure which one I like. I like this one, I think.
Yeah. And it's going to vary.
Rolls.
Right.
And we've got some of them down in our Amazon link down below,
Sure.
I think. But
We should get more because these are good quality.
yeah, they're very good quality. And this has a strap on so it can go around the chair if you're
Right.
in an office chair or in the car.
Yep, and the car as well.
And,
it's pretty stretchy.
You know, you put it down right in the low back. I like it a little bit lower on the
Yep.
sacrum there. And you know, it keeps you in that arch while you're working or while you're driving.
Right. And you know you got the right size because it's going to feel good right away. It's going to feel like, oh, boy, that is very comfortable.
Right. It shouldn't feel awkward or bad or.
Right. And what we always suggest is, how do you know which size you should order? Take a towel and just roll it up. You can put some rubber bands around it. Now this would be a pretty thin one. And if I use this one and I put it here in a car seat like Bob has, or a chair, and I find out that this particular size works, well, you can see that's going to be
about where you want to be.
And that's going to be, and it's got a size on there, and I believe this is a medium or a small. Without my glasses, I can't read it.
And they have different densities too, is what you're saying, Brad, right?
Right. Yep. Some say they're firm, some say they're soft, and you'll get a feel for that.
They have an inflatable one that we haven't tried yet.
Yeah, I'm kind of curious to try this one.
So you could put a little bit different amounts of air in there, and you can, you know, depending on the day, you can, you know.
Yeah,
so,
vary the amount of
see how it feels once?
arch you have in your back.
Yeah.
Yeah. Now, we're spending some time on this part because this is important, particularly if you have back pain when you're driving. You need to adjust your back so that you don't irritate your back and leg pain as a result of driving to work.
Sounds good. Brad, I think we're running a little bit long
Oh
here,
my
so,
gosh,
so,
Bob, time just flies when you're having fun.
all right, thanks for watching.